Last month, Diane Pretty was refused the legal right to choose the circumstances of her own death. She suffers from a motor neuron disease and is experiencing the disintegration of her body. She faces a death that she believes will entail indignity, suffering, and physically cannot kill herself. The court has denied her request for her husband be allowed to help her. According to PMC, and why active euthanasia and physician-assisted suicide should be legalized, assisted suicide is suicide undertaken with the aid of another person. This term usually refers to physician-assisted suicide, which is suicide undertaken by a physician or healthcare provider. People like Diane Pretty, who is shown below, in a state where she is clearly happy and in a state that she can clearly not do anything in herself, should have the legal right to physician-assisted suicide. Physician-assisted suicide should be legal in all states because it will follow patients' rights. 8 out of 50 states already have it legal, and it will benefit people that are terminally ill. Safety and patients' rights. PAS would increase respect for patient autonomy and relief of suffering. Patient autonomy, according to Yale J. Biomed in Pros and Cons of Physician-Aided Dying, is the patient's right to have a say in their medical treatment. In the Medical Code of Ethics, it clearly states that physicians should not abandon a patient once it is determined that the cure is impossible. They must respect patient autonomy, must provide good communication and emotional support, and they must provide adequate and appropriate comfort, care, and adequate control. This means that without having physician-assisted suicide, these physicians are not covering the Code of Ethics. Furthermore, when patients are in the hospital, they are given a list of rights they have as patients. According to the American Public Health Association and Patients' Rights to Self-Determination at the end of life, these rights include patients' ability to express their wishes and advance directives, to appoint a surrogate to make these decisions for them when the patient is no longer able to do so, and to have these wishes honored by the patient's physician. Physician-assisted suicide being illegal goes against these legal rights that patients have. Some people may say that if we did this, then there would be many people that would try to just do it even though they did not terminally ill. Most states that already have these laws have many requirements that you have to meet. For instance, you have to be a resident of California, Colorado, District of Columbia, Hawaii, Oregon, Vermont, or Washington. You have to qualify for a prescription under physician-assisted dying laws, be 18 years of age or older, be mentally competent to be able to communicate to your healthcare team, and be diagnosed with a terminal illness within reasonable medical judgment, which will lead to death within 6 months. Currently, according to the image shown below right here, which is from triagecancer.org and Death with Dignity laws, 8 out of the 50 states in the United States currently have laws in place allowing physician-assisted suicide, and more are planning to vote this into law the next election. On the map, the states that are dark blue currently have laws that make PAS legal. Light blue states have PAS legal with court decision, pink states are voting on these laws next election, and red states have not begun discussion over these laws. Let's look at some particular state laws. Oregon is currently the state that has had physician-assisted suicide the longest. According to Oregon.gov and Death with Dignity Act, on October 27, 1997, Oregon enacted the Death with Dignity Act, which allows terminally ill individuals to end their life through the voluntary self-administration of lethal medications, expressly prescribed by a physician for that purpose. Even with some states having these laws, terminally ill patients should not have to travel to one of these 8 states to get treatment or help. Some people say even though some states have it legal, that doesn't mean all states do. That is correct. Physician-assisted suicide was decided federally that it's up to the states. However, terminally ill patients should not, and some may not, be able to transfer to these states that it is legal. Legalizing physician-assisted suicide would benefit terminally ill patients in 3 ways: mentally, economically, and physically. According to triagecancer.org and Death with Dignity, by adding a voluntary option to the continuum of end-of-life care, these laws gives patients dignity, control, and a peace of mind during their final days with family and loved ones. Terminally ill patients should be looked after in all ways, including mentally. These patients should not feel like they have no control over their choices. Legalizing PAS would also benefit terminally ill patients physically. According to Lynn Eldridge in Is Death Painful?, up to half of people with cancer experience pain. That number rises to about 80% in the advanced stages of cancer, and more than 25% of people said their pain and suffering was intolerable. Yet only half of these people get reliable pain control. These patients should not have to suffer all of this pain if they do not want to. If PAS was legal in all states, patients could avoid this pain. Furthermore, PAS would help terminally ill patients economically. According to Wade M. Smith in The Ethical and Economic Concerns of Physician-Assisted Suicide, usually when a patient is terminally ill, the expenses of medical care can rise quickly due to the aggressive treatments, costly medications, and long durations of hospital visits. Not only do the expenses pile up for the patients and their insurance companies, but the expenses can pile up for the patients' families as well. Legalizing PAS would benefit all terminally ill patients economically because they would not have to stress about paying to be in a hospital bed or making sure their family can pay for these bills. If physician-assisted suicide was legal, then terminally ill patients would benefit mentally, physically, and economically. Some people may say that assisted suicide in any way is unethical, therefore it should be considered murder. However, these patients are already going to pass and have to consent to physician-assisted suicide. Therefore, you are helping someone, not hurting someone. Physician-assisted suicide should be legal in all states because it will increase safety and give patients their rights. 8 out of 50 states already have laws in effect, and it would benefit all terminally ill patients. Thank you.